Now we will talk about skull. We were discussed about how many bones in skulls. 29 bones are there. Some are paired and some are unpaired. Some are single bones. And now we will talk about sutures. Sutures and fontanels. What is fontanels? And what is sutures? Sutures, it means that there is a joints between skull bones. Proper way we will immovable fibrous joints in skull. It means there is a joint, but there is some fibrous joint. How we will make them? And fontanels means write a definition. First, just write a definition. The unossified gap in skull are called fontanels. We will discuss all about fontanels. First we will talk about the sutures, how they are in number and how. First, this is a skull. Okay, skull, nose. Let's make it very beautifully. This is a skull. There is a nose, or of course, sorry. Then this is a frontal bone. This is a occipital bone. Let's revise. This is a parietal bone. I'm just revising them. Parietal bones and temporal bone. How they are joined together with the sutures. First suture will be this. This is which bone is this? This is a frontal bone. Second one is like this. Like this. This is occipital bone. They both are separate, and in the center one line is over there. This is a suture. What the name of them? What is the name of them? First, this one is coronal suture. Okay, this is coronal, and this is lambdoid suture. And this one we call that some books and some teachers are telling about vertex sutures like this, but this is sagittal sutures. Now you understand. This one is frontal bone suture is coronal suture. Second one is sagittal suture, and third one is lambdoid suture. Sagittals also call this is a vertex area. This is a vertex. What we call that? Vertex. When you came to the clinical, then there is a lot of important about that vertex. Vertex where is situated in parietal bones. And how the coronal suture will be made? Frontal plus 2 parietal bone. This is coronal. And sagittal is parietal plus parietal, and lambdoid is parietal plus 2 occipital. Now you understand. There is what is suture. Sutures, immovable fibrous joints in skull. This is called sutures. 1, 2 and 3: coronal suture, sagittal suture and lambdoid suture. And there is a fontanels. How these fontanels are taking place in skull. First, this is a skull, nose, okay. Fontanels are most important thing in during childhood. This is now tell me, this is coronal, this is lambdoid and this is sagittal. There is 6 fontanels. 6. First one is anterior fontanels. Second one is posterior. Just write it. Then I will tell you where it is located and how they are opening and how they are closes. Fontanels. And third one is lateral fontanels. Lateral fontanels also anterolateral and posterolateral fontanels. Okay, write it. Okay, then how they are appeared in skull. And this one is also called bregma. I am making, this is triangle, this is quadrangular. Why? There is a lot of meaning of them. Lambdoid suture, and there is a bregma. There is also called that lambdoid area. This one is anterior fontanels, and there is posterior fontanels. Actually, why am I talking about this in this with this topic? Because there is a lot of importance in lot of exam. They are asking about this. Lambdoid, bregma, posterior fontanels, and posterior means posterior, anterior means anterior. And what about lateral? This is lateral. Unossified bones are there. This is lateral. I told you, anterolateral and posterolateral. This is anterolateral and this is posterolateral. Simple. Okay, anterolateral and posterolateral. Now see how they are closest. They are like this. And which time? Why this is important for clinical purpose? Clinical purposes, why there is importance? I told you this work closes near about 18 to 24 months, and this one closes 2 to 3 months after birth. And they both are anterolateral and posterolateral, closes at suddenly after birth. Okay, now understand, there is a 3 types of fontanels: anterior, posterior and lateral. Anterior fontanel, we call them bregma. This area is also called bregma, and this is lambdoid. Lambdoid is posterior fontanels, it closes 2 to 3 months, and anterior fontanel closes 18 to 24 months, and lateral, you understand, suddenly after birth. It closes suddenly after birth. Now, what is the clinical purpose of fontanels? Clinical purpose of fontanels. Anterior. Most of time we are using anterior fontanel for which one is anterior fontanel? This one. This one is anterior fontanel, triangular in shape. Is uses to check hydration of child. First point. Second point, state of ossification of child. Third one is state of IC pressure. IC pressure means intracranial pressure. These 3 points are most important for exam purpose. When there is closes, and when there is this one is closes at 18 to 24 months, and posterior fontanel closes at 2 to 3 months, and lateral closes suddenly after birth. So now you understand sutures and fontanels. Sutures are immovable fibrous joints on skull.